So with the housekeeping out of the way, this is our first webinar in the LSU Superfund Research Center's Community Engaged Webinar Series, Best Practices for Community Engaged Research for Environmental Health. Today's webinar will start with a presentation from Jennifer Abraham Kramer, followed by our keynote speaker, Wilma Subra. At the end, as I just mentioned, we will have the combined Q&A session. And with that, I'd like to go ahead and introduce our first speaker. Jennifer Abraham Kramer is the director of the T. Harry Williams Center for Oral History. She oversees oral history projects for LSU libraries and manages an oral history collection of over 6,000 interviews with topics on Louisiana politics, the military, culture, the environmental movement, civil rights, women's history, and coastal changes. Jennifer Abraham Kramer served as the media review editor for the Oral History Review from 2010 to 2018, and it is my pleasure to welcome here today. Jen, with that, I'm going to stop my share and feel free to share your screen.
So I'm actually here today at the behest of Peggy Franklin, who can't join us right now. It's a real honor to represent her, and I hope that I do this amazing book justice. So for this presentation, I'm briefly going to discuss the book and how it came together and talk a little bit about oral history, not only as a research tool, but also as a way to engage communities. And then we'll close it out by hearing some of the voices from the women who were interviewed for the project. Louisiana is to the environmental movement what Selma, Alabama is to the civil rights movement. I love this simile from Bill Moyers, invoking the powerful image of a pivotal grassroots movement. The history would be invisible if it were not for one, Peggy's tireless efforts to tell this story, and two, for 46 people who took the time to sit down to record their life narratives. Women Pioneers of the Louisiana Environmental Movement by Peggy Franklin and Susan Tucker was 15 years in the making. Peggy began her endeavor in 1998, and the book was published in 2013. It's hard to believe that it's been 7 years since the publication, much less 22 years since Peggy started this work. Sadly, in this time span, 9 of the women who were interviewed for the book have passed away. One of the benefits of oral history is that their interviews are recorded and available to listen to today, so their voices are preserved in perpetuity, not only for other researchers, but also for family members and loved ones. I was very fortunate to be able to work on this project, first as an interviewer beginning in 1998 as my very first project for LSU, and then later as in my capacity as director for the repository where the interviews are housed. Women Pioneers is used today, as far as I know, to study not only the environmental movement in Louisiana, but also to shed light on Louisiana politics. If you haven't already gotten your copy, there's info at the end and a resources page on where you can get yours. Also, if you're a part of the LSU community, it's available as an ebook through LSU libraries for free. So on the left is Susan Tucker with Peggy Franklin in the middle and me on the right. We're at the Louisiana in 2013. The book was first published, and I thought you all might enjoy hearing from them.
So I thought I'd begin with asking Peggy a question. And that question is, Peggy, what inspired you to do this book?
Oh, I was sitting in a women's history class in McNeese in the 1990s, and the professor was talking about women and their stories. There had hardly been any books written about women until the 1960s, and I thought, I think I could write a book about women environmental activists that I've met around the United States. I became an activist in 1982, and I networked with a lot of women around the United States, and I met someone from Vermont, California, Alabama, and I thought, these are remarkable women. So that was sort of the seed that was planted. I think I can write a book. And then I was at a party in New Orleans, and a going-away party for someone, and there was a professor from Loyola there, Barbara Ewell, some of you may know her, and Amy Cliff, who's a writer and editor in New Orleans, and I was telling them I was going to write a book. I was going to write a book about women in the United States that I had met that were environmentalists. And Barbara Ewell said, no, I think you need to write a book about Louisiana women. There are a lot of wonderful women in Louisiana. I thought, yes, I've met those women. I'm going to do that. And then I just sort of forgot about it. And the next week, Amy Cliff called and she said, I'm volunteering to help with a book. And I thought, I'm stuck. So that's the seed that was planted at that party. And the motivation came from this class, the women's history class. So that's how it started. And I hope that these stories, that other women will be inspired to know that one person can make a difference. And you don't have to be famous. You don't have to be a professional. You can just be a housewife, because most of these women in this book are housewives.
The book was guided for those 15 years by a committee and included people from Loyola, Tulane, LSU, and Louisiana Environmental Action Network, LEAN, among others. Peggy and the community members also sought guidance from the LEH, or the Louisiana Endowment for the Humanities, and ultimately wanted the book to be a university press publication. Early on in the process, Mary Price, the director of the Williams Center at the time, was on this committee and advised Peggy to use oral histories. So Peggy held 3 criteria for those who were interviewed for the project. 1, they had to be active between 1976 and 1996, when environmentalism was just beginning. 2, they had to have improved Louisiana's environment by making real change a law, a policy, or a major land use project, or they founded an environmental organization. The 3rd criteria was that their work had to take place without institutional support or funding. This slide is from the title collage of some of the women and men interviewed. There's another slide to follow in a few slides. An asterisk depicts the women who have since passed away. This is a shot of the table of contents from the book, just to give you an idea of the flow. I think I can correctly state that Peggy and Susan let the voices of the women shape the overall arc of the book, meaning we had a set of questions going into the interviews, open-ended questions, because that's one of the hallmarks of oral history. And through the stories that people told, Peggy and Susan began to see themes emerging, including crossing boundaries, religion, politics and gender, activism, bridge building, and allies, experts, and adversaries. Again, this is a shot from the book's title page. And if you're interested in taking a closer look, this PowerPoint will be available online if you'd like to. And it's worth mentioning here that Ann Williams and Mary McCassell, who were both interviewed for the book, are not pictured. So why oral history? Well, the answer really lies in the what and the how and the mission. Oral history is a qualitative research process. It's based on personal interviewing, suited to understand meanings, interpretations, relationships, and subjective experience. It results in a primary source that is preserved, shared, and available for researchers. Baked into the process of throughout best practices is this concept of shared authority, meaning that we see the interviews as equal partners the entire way through. And this is reflected in our informed consent, opportunity for restrictions, transcription review, and copyright. Oral history lends itself well to document underrepresented communities to attempt to democratize history, to fill in the gaps. Part of the center's mission is to engage in public outreach as a means to this end. And even though we have a small staff, it is through this outreach and partnerships like the one we have with Peggy that collections grow. Obvious rewards of oral history methods are multiple perspectives. So for example, the experts and adversaries chapter in the book. Other rewards are the opportunity to explore community dynamics through the process of collecting the interviews. This can be seen throughout Women Pioneers as Susie, Peggy, and those who were interviewed actively explored community memories and identity together in the process of doing the project. Peggy and Susan talk about how the movement crossed boundaries, generations, geographic, cultural, socioeconomic, and race. And in terms of identity, the three of us found it, particularly interesting that many of these women did not really consider themselves activists, but rather mothers, grandmothers, and citizens. So the other big reward that's baked into the oral history process is collaboration. And this is one of my favorite parts. We're the experts on oral history and best practices, and you are the experts in your field, in your topic. So when we come together, we create this well-rounded resource and an opportunity to engage community members to explore, document, and create historical records that truly reflect the community's diverse perspectives. An oral history project can act as a bridge, not only between our true groups that are collaborating, but also to the public at large. We can see this in the Women Pioneers Project. There's this community of women working for a cleaner Louisiana, and Peggy and Susan's works shine a bright light on the depth and the breadth of this community and their cumulative impact on Louisiana's history. And some of the conversations before the webinar, Margaret, Wilma, Jen Irving, and I were chatting, and Margaret posed the question, what can we do to help people on the ground? Well, in terms of oral history partnerships and engaging through a sort of crowdsourced oral history qualitative research process, places like the Williams Center, we circle back to collaboration. So, for example, the center offers our partners including training. So this includes training for the people who are running the project, students, volunteers. We provide support for grant applications. In the end, we provide preservation and public access to interviews, multiple repositories, and co-curating exhibits. Here's some of the examples of environmentally themed partnership projects, and links to them are embedded in the PowerPoint if you'd like to explore more later, and I can discuss more in the Q&A period if you'd like. Collaboration can also go beyond bridge building to mitigation of cultural impacts on communities negatively affected by industry or environmental disasters and/or loss of culture. For example, the center partnered with the Imperial Cow Cashew Museum in Lake Charles to document the history of Mossville, Louisiana. This rural Black community had been negatively impacted by industry for decades and was undergoing sudden changes due to Sasol's expansion and subsequent buyouts of the properties in the area. This type of project involves the community heavily, and we made sure that the collections are housed in multiple places within the community for ease of access. Multiple points of access brings me back to Peggy's project, which was the first center collaborative effort to focus on Louisiana's environment, and the first project we had that documented exclusively women's work. And I think this is a great place to mention that out of that partnership has grown a collaboration with Lean. Mary Lee and Michael Orr have curated a dynamic gallery exhibit on the work of the women featured in Women Pioneers. And one of the many things I look forward to in a post-COVID world is the opening of this exhibit to celebrate the women's accomplishments. I'm going to switch screens really quickly to share our website with y'all. So this is Deborah Ramirez of the aforementioned Mossville, Louisiana. Her home was adjacent to petrochemical plants, and she fought several of them regarding groundwater contamination.
With the plant early on, because I remember when it would explode, we didn't have an alarm, but the whistle would go off, but the police would come in. I say police, but the sheriffs would come, and they would tell us to hurry up and get out. And we ran. Sometimes we were in our sleeping clothes, barefooted. And we were running Old Spanish Trail where gators were. They had gators in there. They had moccasins crossing the road, because don't forget, we talking about swampland.
And of course, you all recognized our next speaker, Wilma Subra of New Iberia, Louisiana. Among her many, many other accomplishments, she is responsible for organizing and representing and furnishing technical data to numerous citizen groups.
The first thing when you get involved in these issues is the industry and the agencies didn't want to hear from the community. They treated them as hysterical housewives, raving idiots, not a clue about what was going on. How dare these people come in here and tell us how we should be doing our job? And how dare them think that we're going to accommodate them when we're trying to do our job?
Gender was an issue that came up a lot in the book. Often women's sex was weaponized against her, as Wilma points out in insults like hysterical housewives. This is Mary Tutwiler of New Iberia, Louisiana, who prevented the creation of a commercial solid waste landfill in her area. And this is her response to such insults.
It wasn't quite hysterical. I think the first thing I was called is a meddlesome housewife. And I kind of liked it because that's what I was. I was a housewife. I had a baby on my hip. And I was certainly going to meddle if they were going to meddle with me, which is, you know, trying to convince me that garbage in my drinking water was good for me.
And when asked why women were so successful in their battles, Rose Jackson of Belle Chase, Louisiana, sums it up when being interviewed about her battle with a hazardous waste landfill that was affecting neighborhood children.
Because they know that a woman is more stronger than a man. And once you mess with a mother's child, you got a fight on your hands.
And to close things out, I missed it, sorry. And when asked, we asked Claire Baudouin the same question, why women? Baudouin, a member of the House of Representatives in Karen Crow, Louisiana, worked to close a commercial solid waste landfill, and she says this.
I think a woman is going to take an issue, and it's not going away, because when you get, I know when I got on my soapbox at the landfill, I wasn't backing off. And then when I took on the off-field facility, I wasn't backing off. And so certainly I think women are more dedicated to seeing a project complete. And I wanted that landfill cleaned up or straightened up or closed, and I wasn't going to stop until something happened.
And now, to close things out, back to the role that religion played in the motivation of many of the women involved in this project. Here's Shirley Goldsmith, who's since passed away, who founded CLEAN and was one of the first activists to emerge in Louisiana. She stopped ocean incineration and worked to close Willow Springs landfill.
And I'm a very, very spiritual person. I feel that this word was given to us as stewards for us to take care of, and we're not the ones that should be destroying it. I have a very strong belief in God, and this was God's message to me, that you don't tear up my earth. It was given to you.
I'm gonna stop sharing and return to the PowerPoint real quick. So here's those additional resources I was talking about if you're interested in a deeper dive. And I'd like to leave us today by posing Margaret's question to us all. What can we do? What can you do? And how can we work together to do it? Thank you.
Thank you so much, Jennifer, for that wonderful presentation. I apologize if anyone was having a hard time hearing the video or the audio clips. We will provide those to you all so that everyone can hear them through their own device. And with that, I would ask you, if you had questions for Jennifer Abraham Kramer, to go ahead and send some of them through the chat box. I'd like to introduce our next speaker. So Wilma, if you can take yourself off mute. Our next speaker is Wilma Subra. Wilma founded the Super Company in 1981 and is the technical advisor for the Louisiana Environmental Action Network. She provides technical assistance to citizens across the United States, as well as foreign countries, who are concerned with their environmental health. Wilma is the recipient of the MacArthur Genius Award, was named the People's Scientist by Discover magazine, and completed a 6-year term as a member of the EPA National Environmental Justice Advisory Council. It has been my honor and privilege to work with Wilma in the LSU Superfund Research Center, and also as a student when I was pursuing my master's in public health. So Wilma, with that, I would like to turn the presentation over to you.
Thank you, Jennifer. And good evening, everyone. We're going to discuss today educating and empowering community members to reduce the negative health impacts associated with environmental pollution. Next, please. So here we have community members having concerns, and their concerns start with trying to advance science and promoting health. So these community members have issues with environmental pollution, and usually it's related to the negative health impacts that they have experienced for their children, their grandchildren, their spouses, their parents, and their grandparents. And when Jennifer was talking about why women are the caregivers. Women are the ones that can do everything that needs to be done and more. And their concerns about their children and grandchildren and spouses and parents lead them to dealing with what is going on in my community. Next, please. So when you look at one of the most prevalent health impacts that the environment pollution is causing to the people that are you concerned about, if we start with asthma attacks, respiratory problems, headaches, skin rashes, those are acute impacts. Those are impacts when you were exposed for a short term, you have those impacts. And then the chronic impacts include things like leukemia, brain cancer, breast cancer, neuroblastoma, angiosarcoma of the liver associated with vinyl chloride, anencephaly, which is babies born without parts of their brains, lung cancer, liver cancer, and birth defects. Next, please. So what do community members want to know to start their process of getting involved in the environment and pollution? They want to know what pollution, chemical and biological, could be causing these health impacts. They want to know where the pollution is coming from. They want to know which facilities are releasing those pollutants and what are the pathways of exposure. And in today's environment, who did you come in contact with that was positive for COVID-19? And one of the ways you can get the COVID-19 is through air emissions. Next, please. So the potential sources of pollutants include things like air emissions, drinking water, contaminated soil, surface water in lakes, rivers, and streams, groundwater, contaminated food, contaminated seafood, sewer plant emissions, industrial facilities, landfills, and waste sites. And here the picture you see is an aerial photograph of open burning of clean harbors. It's a photo that the Minden Press had published, and you see those trays with all the flames coming out. That's where they ignite and burn the kind of waste I'll talk to you about in just a little bit. Next, please. So when you work with the community members reach out for help to understand what's going on in my community, how to address and lessen the negative health impacts in my community, and then how to reduce the exposure. And just to your right, which you can barely see behind our pictures, is Mr. and Mrs. Gosson, who you saw with Clara Baudouin giving each other the high five near the landfill that was right next to their home. They succeeded in having the landfill shut down, and then the city put in methane reduction, sucking out, and all that methane process and piping leaked. And so they were having to deal with the methane issues once they were able to get the landfill closed down. Thanks, please. So what are the ways that we help the community? One, we first evaluate the environmental and social situations in the area that they have classified as an area of concern. Then we research the local zoning situations and compliance with zoning requirements. And what we find over the many years is the zoning requirements have changed, but because they were rezoned way back when, they don't have to meet the newest zoning requirements, so they can be right up against the community. Then we looked and researched the history of the environmental permitting process, the inspections, the compliance orders, and all around the target area. And once you start working with DEQ and looking at the Department of Environmental Quality and EPA's files, you find things that you don't necessarily agree with when they went out and inspected and then wrote compliance orders. And then number 4, you check out the old industrial facilities and dump sites, because they could be potential sources of contamination that you either can no longer see or they're just rotting there around. Next, please. So in addition to that, we do provide the community members with handouts. I always give them handouts to take home, share with their neighbors, and look back and say, what was that number we were told 2 weeks ago? Now it's increased and we want to compare. So they have all the documents they need at their home to compare to. Then we engage the assistance of educators, university professors, and students to assist and participate in the educational components and research needs by community members. And Jennifer Irving told you about some of the work that we did together in that aspect. And then when an emergency situation occurs or new data comes out that's critical to the situation, you quickly call a meeting and bring the community back together and provide them with all that information so that they can walk and talk the issues and not have to answer their neighbor with, I don't know yet. They will know in a day or two after this situation develops. Next, please. So in addition to the ways to help the community, once the community members become educated and involved, the larger community, not just their group, not just, quote, their hysterical housewives, together they can use the information as a basis to request appropriate authorities to take action that can help reduce chemical or biological exposure. So on the following examples I'm going to talk about, these populations consist of a large portion of environmental justice members. Next, please. So Clean Harbors facility is in Colfax, and Brenda Valley, Brenda, raise your hand, you're on the screen. She's the community leader, and they form Central Louisiana Coalition for a Clean and Healthy Environment in Colfax. And Clean Harbors is an open burn, open detonation, hazardous waste thermal treatment facility that ignites and burns explosive and ignitable waste. And they cause tremendous negative health and quality of life impacts to the community members. And we would like to live, how would you like to live in the fence line community for this facility and have burning and smoke coming into where you live every single day from 8 o'clock in the morning till 5 o'clock in the afternoon? Think about what this community goes through on a daily basis. Next, please. Okay, so the Central Louisiana Coalition, the community members provide comments to DEQ. And at first they were real reluctant to call up. And then once they figured out that the people were going to really record their complaints, just under 50 of the community members regularly submit complaints. And in a year's time, over a whole host of years, they submitted at least 365 complaints to the Department of Environmental Quality. And community members' complaints have occurred from before September of 17 until the present time. DEQ began obtaining burn logs for each burn event on the dates that communities submitted the complaints. And now we have a record of the waste burn that provides the community what's going on. So they submitted a complaint, and in a couple of weeks to a month, we know exactly what waste streams were being ignited that caused them to have to submit a complaint. Next, please. So the Central Louisiana Coalition for a Clean and Healthy Environment, in response, DEQ has documented a large number of permit violations, basically as a result of all the complaints that the citizens have called in and the citizens have written letters about. So Clean Harbors has been issued by DEQ 5 consolidated compliance orders and notices of potential penalty. They've received since 2016 4 separate notices of potential penalties and more than 30 warning letters dealing with violations of their permits. And then they were issued a penalty assessment in November of 2018 for over $883,000. And most of those penalties related to the complaints the community members turned in. And then as a result of these, the company appeals and appeals and appeals. So none of these that I just listed have become final. They're all under appeal. And so in 2019, we had the hazardous waste disposal report issued by Clean Harbors. And that was issued a couple of months ago for 19. We do not have 20 yet. And they received hazardous waste from 331 generators from 46 states and Puerto Rico. And they received over 290,000 pounds of net weight. That's how much explosives were in. A lot of the packaging and all doesn't count as the net weight. And so as a result of this, in January of 2020, DEQ issued a notice of intent to deny the hazardous waste air permit that Colfax was operating under. And they appealed that, of course, and then the fall of 2020, they applied for an alternative technology, a contained burn system. So it will take years for the permitting process to go through for that, and we'll have a public comment. We'll have to have all the citizens educated about participating, and they do really well in public hearings. And then there'll be the construction issues. So for many, many years in the future, you will see this open burning continuing to take place until we were able to get an alternative technology permitted and constructed. So the people have a long time to suffer some more. Thanks, please. So in 2014, the National Air Toxics Assessment released their evaluation of ethylene oxide. They released it on August 22nd of 2018. Louisiana has 13 facilities that release air emissions of ethylene oxide. The number 2 ranking air emission facility in the whole United States is Union Carbide Dow facility in Hahnville. And Dow, Hahnville, Union Carbide just settled with the Department of Justice, EPA, and Department of Environmental Quality for emissions that were coming out of 26 flares at their 4 facilities. One Dow facility is in the community of St. Charles. The other one is across the river from Baton Rouge, and then 2 of the others are in Texas, in Orange and Freeport. They will find $3 million, and they supposedly have agreed to pay it. And they are going to reduce 5,600 tons a year of volatile organics and 480 tons of hazardous air pollutants at those 4 facilities. And they've agreed to do thin slime monitoring. But you see the slide of EPA's risk of ethylene oxide in St. John the Baptist Parish by census tract. And EPA said if it's over 100 per million risk, it's of concern. And so every one of the census tracts in St. John the Baptist Parish is over the level of concern. And one facility is in St. John and the other is the Dow facility across the river. Next, please. So on March 31st of 2020, the EPA Inspector General issued a management alert. And that alert said that the EPA, in conjunction with the DEQ, had to improve the risk communication in communities where the cancer risks are potentially elevated due to ethylene oxide. So, January 14th of this year, right before the administration changed, the EPA Administrator, Andrew Wheeler, rejected those urgent recommendations and just said, we're not going to do it. We can't agree to do it. We can't figure out what to do. We're not going to do it. So since August of 18, I began conducting workshops in Louisiana communities where facilities were releasing ethylene oxide. In 5 days, I had the first one in the community, giving them the handouts and talking to them about the issues and the emissions from ethylene oxide. And I continue doing that today to all over Louisiana. So I've been doing it even though EPA and DEQ will not do it. Next, please. In December of 2015, the Dinka Performance Elastomer facility that was a DuPont Pontchartrain Works in La Place Reserve, in December of 2015, NADA classified chloroprene as a likely human carcinogen with a long-term cancer-based comparison level of 100 in 1 million cancers is 0.2 micrograms per meter cubed for chloroprene. And Lean actually put together shirts for the community, t-shirts for the community to wear, and it says only 0.2 will do. So the census tracts where Dinka is mostly physically located has a risk of 776 per million, and that is the highest risk in the whole United States. And then the one that Dinka is partially located in has a risk of 426 per 1 million. So NADA estimated higher than expected levels of chloroprene in La Place Reserve and their ambient air. And EPA identified the DuPont Dinka facility as creating the greatest offsite risk of cancer of any manufacturing facility in the United States. So I know a lot of you on this call have specific sites that you think are the worst ones in the United States. Well, we have it in St. John the Baptist Parish, and EPA testified to that effect. Next, please. So we also did biomonitoring on community members in the reserve La Place area, and all the individuals tested had metabolites of chloroprene in their urine. Chloroprene is quickly metabolized by an organ in the body, so chloroprene itself is never excreted in the urine, just its metabolites. And every one of these individuals had the metabolites. And Adrienne Katner's on this call, and she and I and a number of other people are putting together an additional biomonitoring for the metabolites of chloroprene we'll be doing over the next couple of months. But this biomonitoring demonstrated that air chloroprene releases are contaminating the individuals that live in St. John the Parish and outside that area. And it is a completed pathway of exposure. Next, please. So I conducted workshops in reserve twice a month and starting in 2016 to keep the community members informed of what was quickly and critically developing as a result of this announcement that chloroprene was a likely carcinogen and 0.2 was the level in the ambient air we should be aiming for. And we did it at the Tchoupitoulas Chapel, which was in the census tract with the with the highest risk. So every time we had a meeting there, we were exposing ourselves to the highest risk of chloroprene in the air as part of that meeting. And then by the end of 2019, we changed to once a month. And then additional workshops when there were critical events or information was released and we needed to get it out quickly so all the community members could understand and deal with it. And then since the pandemic, we've changed to virtual, and I always send the handouts, and then we go over the handouts virtually as opposed to in person. So January the 6th of 2017, DEQ issued an administrative order on consent, which required DINCA to establish 4 air emission control technologies and reduce the chloroprene air emissions by 85% based on 2014 air emissions. And I looked at all the calculations and I knew 85% was not going to give us anywhere near the 0.2. Next, please. So EPA air monitoring around the DINCA facility was conducted from May the 25th of 2016, right after NADA announced the 0.2, and it stopped September 26th of 2020. EPA's monitoring for chloroprene at 6 locations all the way around the facility, and new chloroprene control technologies resulted in a reduction, as you can see here, but it didn't get anywhere near the 0.2 in the ambient air. So the maximum concentrations continue to exceed 0.2 at all 6 of the locations around. And one of the 6 locations is called the 5th Ward Elementary School. And in November of 2020, it had a maximum concentration of 15.2 micrograms per meter, which was 75 times over the 0.2. So the community is not breathing easy because they're still being exposed to unacceptable levels of chloroprene in the air they breathe on a daily, weekly, and yearly basis. Next, please. So the Mississippi River Industrial Corridor parishes, which are sometimes known as Cancer Alley, are in the top 50 counties in the whole United States based on deaths caused to coronavirus. So the medical conditions that increase individuals' vulnerability to severe illness and death due to COVID-19 consist of hypertension over 65%, diabetes over 38%, neurological disease over 27%, and cardiovascular disease, chronic kidney disease, obesity, congestive heart failure, pulmonary disease, cancer, and asthma. And then as you see on the next slide, only 5% of the COVID-19 fatalities victims had no pre-existing conditions. And when you look at the air emissions that are released from the industrial corridor along Cancer Alley, as well as the other industrial areas in Louisiana, you see that a lot of the pre-existing health conditions are caused or exacerbated by the chemicals that are being released into the air in which all these community members live. Next, please. So, educating and empower community members to reduce negative health impacts of environmental pollution is critical to protecting and improving the quality of life, lessening risk of exposure to toxic chemicals in the environment in which all of us live. I would like to encourage each participant to identify the toxic chemicals and biological pollutants that exist in their environment and the potential sources of that pollution that's in their environment, and submit that information to this webinar so we can compile that information. Thank you very much.
Thank you so much, Wilma, for that wonderful presentation. It looks like we're going to have plenty of time for question and answers. So please go ahead and submit your questions through the chat box. And I will start off with the questions I've received thus far. And Wilma, this first question is for you. It's from John Sullivan, former member of the Seeley Center for Environmental Health and Medicine. And the question is, what do you recommend when one, disinformation or denial has seriously interfered with acceptance of public health risk management information, Or 2, the science is uncertain about risk and the public doesn't know what or who to believe?
So when you have controversies, which we usually encounter, you put all the available information and data out for the community to see, as well as you brief the agencies, the environmental agencies and the health agencies, and lay out both sides of the debate. And then also, if they insist on not doing anything, like in the case of Dinka, the company has appealed the 0.2 and EPA has turned them down a number of times. Then they developed a model and we're doing a peer review process of that model. And meanwhile, the emissions are still being released. So you have to put all the data and then just educate the community to understand this is what we think is appropriate, but this is what the other side thinks is appropriate. So they know both sides. If you don't do that, then they're going to always be hearing in their ear, everything you say is wrong. Thank you, John, for that question.
All right. Another question coming in from Kate Jackson. Wilma, this is also for you. She wants to know more about the biomonitoring program and specifically if there was a grant to pay for that.
Yes, a number of individuals have gotten grants to do the specific biomonitoring. You have to have usually an institution review board accept the protocol that you're going to use. And then you have to have qualified people participating in it. But it's critical to be able to do biomonitoring. We've done it at a number of locations associated also with air emissions. So you can say it's the air, these are the chemicals in the air, and this is what went into their body, and this is what came out of their body. Or if it's if it's a groundwater or a water pollution case, when we have a lot of those, these are the chemicals in the water they're consuming, and this is what they're excreting from their body, and have concentrations on both of those.
Wonderful. Thank you. Another question, this one from Deanne Williams, and they would like to know, how do you address contaminants that do not have acceptable or hazardous limits or that are unregulated, such as odor and other chemical contaminants?
So a lot of contaminants have a concentration in a permit from an industrial facility, but don't have an acceptable health base. So you just make sure that you have a lot of information about what those concentrations are in the air coming out of a facility or in the drinking water or whatever type you're looking at. Have all those numbers, so even though you don't have a criteria to compare to, we have the 0.2 and they're always trying to dismiss it, but you know what concentrations people are being exposed to based on the amount of coming in from whatever exposure route you're looking at.
Okay, Wilma, I have another one for you, and then I might switch. We have a few also coming in for Jennifer Abraham Kramer. But this question is for me, and it's a little bit more general. I feel incredibly privileged to have been able to work with you. And I guess my question is, what is your top 1 or 2 pieces of advice that you would give to students or researchers that might just beginning to be working with communities on something involving environmental health?
Number 1, always listen to the community. When you go in at first, you may think they're totally wrong, and then in the long run, you're going to find out everything they know is correct. So listen to the community and respond to what the community is asking you to do. Don't walk in and say, I'm going to do A, B, and C, and they don't really care about A, B, and C. And then also involve the community in every step of the way. And then you will find that you will have an educated and empowered community that you can deal with for a very, very long time.
All right, thank you so much. Jen Abraham Kramer, this is for you from Jennifer Richmond Bryan. And she actually would like to know, are you aware of any gaps in the oral history library that need to be filled? What stories have not yet been told? Take it away.
All right. Well, thanks for that question, Jen. So yes, there's tons of gaps out there in the record that needs to be filled. And the quest to document underdocumented communities will likely never end. And I'm so grateful that that's built into the mission of the center in that way. So, our best bet is to let people know that we can help do that, and that's what that's what we are created to do, and to kind of show what we've already done, and then hopefully people will come to us with ideas about filling in gaps. So for example, people have come to us about the Louisiana trans community, LGBTQ plus community, in all of Louisiana. African American history has been a core component of what the center has been reaching out for since we were founded back in 1992. Native American history, rural history, Latinx history. Recently, Lebanese oral history project came to bear. We have a lot of Lebanese community, but not a lot of oral histories on it. Women, always women. I have a graduate student here today who's doing a project on women in Louisiana government. She looked at our collection and said, hey, you've got all these old white men. Where are the women? And so she's out there, not all of them were old, but she's out there doing those interviews right now. The Jewish community. I mean, the list can go on, but anywhere, and Louisiana is such a diverse place. So you can really walk outside and look outside your door, and there will be an opportunity for, helping fill in those gaps. Thanks.
I have another question from me, Jennifer Kramer, also for you. And my question is about the benefit to community members or individuals to participate in an oral history project. The oral histories and the women pioneers of the Louisiana environmental movement were for the most part collected after the various environmental conflicts were resolved. Does the benefit or maybe the motivation for doing oral histories change when the event is something that's ongoing?
Yes, I love this question. So it really does change when you switch gears from looking at something that's happened in the past to something that's ongoing, and the context is a little bit different. The way our brains remember the recent past versus the distant past are two totally different things. So the recent past, we're really going to focus in on the how and the what and those very, very rich details. And it's going to be a little spotty. It's going to be a little fragmented. It's going to be all over the place. And that's fine, because that's how we do that's how we discuss the present. And when you're recalling something in the distant past, people haven't had an opportunity to integrate and to place that story within a bigger context, and they've had the opportunity to look at causal relationships. So when you embark upon an oral history project where you're talking to people about the now, there's some mitigation things that we need to do, because people could be potentially vulnerable. There might be potentially trauma that's happening, just depending on what the topic of the interview is. And that can be easily mitigated with project planning, getting out ahead of it, bringing in some experts on that sort of thing, like, how to sort of navigate what I like to call trauma traps, because they can, an interviewer can be, affected by compassion fatigue and burnout, or they may have their own issues with the thing that people are talking about, where and the interviewee may be still processing everything that's going on. So not only from a brain perspective, but also from everything that goes with that, and the embodiment of that, like emotions and the way the body is feeling, but also legal issues and insurance issues, like it really, and also how the community might be relating with you kind of issues as well. So for example, when we were talking to the women who were involved in Peggy's project, that might have been 10 or 15 or even 20 years ago. And they were able to kind of reflect on the things that were challenging about that. So people, in the community, not treating them, or, maybe not that they're not treating them well, but maybe they're ignoring them, or maybe, there are some negative repercussions. Whereas if you do that in the middle of it, it's just a different sort of dynamic. Doesn't mean that those projects aren't, and those topics aren't valuable to know. It's just a matter of, it is a different approach for doing present oral histories and sort of past oral histories. And the benefit anybody participating in an oral history project is that if you don't tell your story, who will? So this is your opportunity to get it on the record, to make it a primary source, and to get it equal to all the other primary sources out there.
Thank you so much. I apologize that my volume has been low. I can see that it looks like it's better now. So I have a couple, Wilma, these questions are going to go back to you, and they're specifically about the Colfax community. And so one question is there plans to do biomonitoring in Colfax? And also questions about the COVID, if there's COVID-19 data available specifically for Colfax.
So the answer to the second question is that the Department of Health puts out data on a daily basis and a weekly basis for parishes and communities. So we can get access to that for Colfax. And the biomonitoring, we're still working, we're part of the LSU Superfund project. And so we're still working on what's going to be monitored in the air. And then if we're going to do any biomonitoring, Brenda and I had discussed before LSU was involved with what we were doing in the community of doing thyroid testing, because perchlorate is one of the chemicals that's an aerating agent that's in most of the explosives, and it's an inhibitor to the thyroid, and most of the people there have thyroid issues. So we had thought about doing some monitoring for thyroid. So all that's going to be developed as we go through this process. And Brenda, you want to answer any more? Unmute, Brenda.
Wilma, she may not be able to unmute.
I'll try. No.
Brenda, if there's something you'd like to say, please enter in the chat box and I will read it through. It's a great response.
She's unmuted now.
Okay, Brenda, please go ahead.
Wilma covered a lot of it. We do have some money set aside for some possible health testing whenever we work this out with the group that we're working with currently. And as I interview people in what we call the rock community, there's a number of people up there that have thyroid problems. They have respiratory problems. It's like they live in the house, and this is a Black community, a poor Black community. So they're less than, the property line of Clean Harbors is about a 5-minute walk from the nearest person that lives up there. So they get a lot of contact with the pollutants that come through there.
Okay, great. Wilma, was there anything else you wanted to add to address those questions?
No, I think that answered them. Thank you.
Okay. And Wilma, I have another question for you. This one is a little bit more general, and it is about climate change. And it is, how do you see climate change compounding problems of communities dealing with hazardous sources?
So climate change has a whole diverse set of negative impacts on communities and on the environment. And what's going to happen is that people are going to be focused on one thing and not looking at climate change. So now we have to add that to the information that we present to communities so that they can comprehend what is, quote, climate change impacts, and then what is other sources of pollution. And like climate change is resulting in more severe hurricanes and also rising sea level. And we had 2 hurricanes and a tropical depression in 2020. And Brenda can tell you what it was like by the time it got to central and north Louisiana. It was just like she was a coastal community. So Brenda, why don't you tell them how severe it was when it got to Colfax? Oh, I have to.
It was bad. And there, you can still drive around and see many of the trees that have fallen. They'll never be picked up. Homes, we still have a lot of blue tarp roofs up here. It was the worst that I've seen. And it was a lot of cleanup. It is not completed. So it's bad.
And then she had snow this year.
Yes. I think I'll take the snow over the hurricanes.
You both. Okay, so I would like to let everyone know that the questions coming through the chat box are slowing down. So if you have questions, please go ahead and submit them. The last one I have is, and if this is all, we'll end early, but the last one I have is for Wilma. And it is, what would be your advice for how to put, and I think this is coming from a researcher, for how to put our skills to work while letting communities take the lead?
Could you repeat it again, please? You were
breaking. Sorry. The question is, what would be your advice for how to put our skills to work while letting communities lead? And I think this is coming from a researcher or an academic.
So it's sort of the same answer. Go into the community and hear from the community. The community will tell you what they think they need. And then you figure out if you can provide those kind of activities to associate with them. And then you can suggest, and maybe in addition, we would add this, this, and this as part of what we're going to do to help you. But the community will feel that you're going to be doing what they think they need. And then as a result of that, then the researchers can say, now in this step, this is what we need to do to further verify the results we've been able to obtain.
Okay, great. And I have one more question. Sorry, I have one more question. And this is about the media. And the question is, what does the media get wrong? Or what do you feel like they do enough when reporting on some of these issues involving environmental health?
So they usually try and ask for comments from both sides of the debate. And then they don't necessarily get it wrong, they just get it inaccurate because of what they quoted and how they quoted it. And they're really trying to cover the entire issue. And mostly the agencies will just have a PR person that comments. And usually the PR person gets it right, but sometimes they get it like totally wrong. And yet there it is. And once it's there forever. And it's really hard to be able to go back and say, no, that's not what I really meant. Da, da, da. But without the media, the message would not be getting out to the greater population. We'd be just sitting in isolation, working in the communities and not providing it to a larger part of the population.
Jen, I can just read the question off. Okay, so the question was, do you have any tips for addressing the continuous questioning about the quality or uncertainty related to the data that you present?
Usually I put down the sources and the dates so that if anybody is specifically asked, I have copies of them to provide. Like in the case of Dinka, I have EPA data off of their website, and I put it in a form that the citizens can look at it and say, that's where I live and that's the number that was in the air on this date. A lot of people like to try and make it charts and wiggles, and the community doesn't understand that. The community can see a number and be able to compare it, like compare it to 0.2 or compare it to a benzene concentration. They want to see the numbers in their community. But yes, you have to have backup for all the information you provide.
Thank you. Well, it sounds like the meeting is slowing down. I'm going to just add to the spotlight our other two speakers. We've got Jen Abraham Kramer and Jen Irving as our moderator, and of course, Wilma Subra as our highlighted keynote speaker. And we just want to say how grateful we are to the three of you for presenting this webinar today. It's been incredibly enlightening, and to thank all of our participants for coming to listen, to learn about the good work going on in Louisiana. And I want to thank Margaret Reams and V. Trong and Holly Caruth for pitching in to help out with all of the preparation today.
Thank you, everyone.